Just a brief introduction of what I do and what generally pathologists do. The purpose of a pathologist in a hospital scenario is to diagnose. That's what I'm going to help with. You must have seen peripheral blood smears, biopsies, genetic examinations, and I am a consultant pathologist who is working primarily in genetics. Right, I work from Chennai. I'm a consultant molecular pathologist. I do real-time PCR, PCRs, next generation sequencing, whatever is required. Right. So what happens is when you have a patient, you're going to identify the patients with symptoms, signs, and everything. Good evening, banana shake. Then you go to a clinician or a physician, right? The clinical examination happens. You will do your clinical examination, your second year of MBBS, and also you will do when you come to your final year and internship, right? So from here, I need to diagnose. Diagnosis these days, whatever we are doing is evidence based, right? So the evidence in diagnosis comes from pathology, microbiology, and a little bit of biochemical investigation, right? So in this diagnosis, there'll be complete blood count. A pathologist does that. FNACs, fine needle aspiration cytology. You put a needle in an organ and take a tiny amount of cell and say what it is, right? And it comes to histopathological examination, right? That also comes here, right? All these will be done by the pathologist. So that's what I do. I help in the diagnosis, not just the diagnosis. To some extent, I know this is a cancer. I have to say whether the patient will live for 2 years or 10 years or 20 years. Prognosis, right? So I have two main roles here. One is diagnosis of a patient, and the second and the most important thing is prognosis. I don't diagnosticate alone. If you're very early part of your medicine, prognosis means the science which tells how fast the disease will heal, or will it heal or will not heal. That's what prognosis talks about, right? So these are my two main forte as a pathologist in a hospital, and here we're going to learn the pathogenesis, what happens in every